Was probably the single most negatively tested word we looked at.
Oh, by far.
Was the word bureaucrat.
The reason that the doubling and the tripling of all these costs is because we have introduced layers and layers and layers and layers of bureaucrats all into the system, all of whom have to be paid with benefits, et cetera, et cetera.
Outside of labor costs, it is the #1 cost for all employers in the country. What people don't realize is that every business is in the healthcare business. I don't care what your business is. If you're in business, you're in the healthcare business. Starbucks spends more money on healthcare than they do on coffee beans.
Because healthcare has become so expensive, it's now their second largest line item. And if we don't do something to bring down the cost while increasing quality, American businesses, including some hospitals, are struggling. Because the American people intuitively understand the system is broken because there are too many bureaucrats involved. And we need to restore that patient-physician relationship and make the American healthcare system actually work for the patient. As we're being told to move into a socialized system or a single-payer system or a government-run system where they're expanding Medicaid from the bottom and expanding Medicare from the top, so they push all the patients into a government-controlled system, we're going bankrupt. And the only way they can control cost is by limiting care.
This hospital reached out to us. We worked with them to integrate within their employee health plan. We saved the hospital $1.2 million in the first year, which was a 54% reduction in health plan costs.
And they were looking to go out of business, and this helped them generate positive cash flow.
They were struggling just like everybody else, and in the 3 years since we've been there, they've had their 3 best financial years in their history.
And in 2020, despite the pandemic, we saved the employees in the school district $1.5 million. And this year we're on track for $2.5 million.
And in most cases, what you're seeing people experience as they, you move to direct primary care using the medical cost sharing model, etc. They're dramatically lowering costs, but they're also incredibly improving their access to the physician and to the quality of care they have, because those physicians working within this cash environment have the time to really focus on their patients.
Our doctors take the Hippocratic oath: do no harm, do everything to alleviate pain and heal the patient. It's always been about the patient.